Welcome to the Endocrine Matters podcast. This podcast episode is sponsored by Complete Medicine and Hey Healthy. Welcome back to Endocrine Matters. I'm Dr. Arti Thangudu, and today I have two of my favorite endocrinologists with me, Dr. Alluri and Dr. Mehta. Between the three of us, we see this every single day. Patients who have been down the wellness rabbit hole, spent real money on cortisol panels and adrenal supplements, and still feel terrible. Today, we're going to talk honestly about what adrenal fatigue actually is and isn't, what legitimate cortisol testing looks like, and how to recognize when someone's profiting from your exhaustion versus actually trying to help you. This is the episode I wish existed when some of our patients first started searching for answers. Welcome to Endocrine Matters. I am so excited to have my colleagues and partners, Dr. Mehta and Dr. Alluri, here recording a very important topic with me today, and that is adrenals, cortisol. We're talking about things like adrenal fatigue, what that is, what it isn't, and they are two of the smartest women I know. So we are just going to hop right in. First, let's start with the basics. So Dr. Alluri, can you walk us through just like basic adrenal physiology? What do the adrenal glands do? Where do they sit? What is their importance?
Sure. So we actually have two adrenal glands, and they sit on top of our kidneys. And they're responsible for making steroid hormones like cortisol, DHEA, and aldosterone. And then the inner medulla of the adrenal gland makes catecholamines such as epinephrine and norepinephrine, or the stress hormones. So that's kind of a basic idea of what our adrenal glands do.
Yeah, and the adrenal glands also make some sex hormones. So the adrenal glands are just like this hormonal milieu of various hormones that do lots of different things in the body. Sometimes they get oversimplified, which they are not simple at all. And so, Dr. Mehta, can you tell us a little bit about how the adrenals have come into like the wellness conversation and have been kind of a magnet for wellness marketing?
The adrenal glands, as we talked about earlier, they produce essential steroid hormones, which help with metabolism, blood pressure, electrolyte balance, and the stress responses of the body. So there's a diagnosis that the wellness industry has coined called adrenal fatigue, which is not recognized as a legitimate diagnosis by the endocrine societies and endocrinologists in general. But the concept, I think it exploits some of the vulnerabilities in how people understand fatigue and stress. They've co-opted these real symptoms and attributed them to a non-existent condition affecting otherwise healthy people experiencing normal stress and fatigue. So they've sort of capitalized on this and created a market for unproven interventions.
So it's this whole trend of over-medicalizing normal or attaching diagnoses that physiologically truly don't make sense, although you can kind of confuse people and tell them the physiology makes sense and perhaps these people don't really know the physiology of the adrenals, but by over-medicalizing it and giving patients a diagnosis, and I say that in air quotes, when they've been dismissed by a system for a long time saying that their symptoms are either not real or all in their head, like people cling to that, they want to feel heard and they want to feel that their symptoms matter and that there is a real problem. Like I always think about when you go to a massage, right? Like the masseuse isn't like, oh, your muscles are fine. You don't need to be here. Why are you here? If they did that, you'd be like, I never want to get a massage again. This guy was a jerk. But no, they're like, oh my gosh, your muscles are so tight. You really need to come every week and see me, Whereas patients have been experiencing in traditional medicine, like you go into the doctor and you're feeling like complete crap, you're tired, you're stressed, you're having all of these symptoms, maybe your hair or skin is changing, like you're really having true symptoms, and they're like, oh, your labs are normal,
Mhm.
let's kick you out in 5 minutes. So, of course, people are looking for alternatives. The sad thing is that there are a lot of people who have capitalized on that and created scenarios where patients are now walking away from traditional doctors because they weren't giving them what they needed truly, and finding other people who are making them think that they are giving them what they need, but often offering them therapies that could be potentially harmful. So, Dr. O'Leary, will you tell us a little bit about what does happen to the adrenals when we're stressed? Because, the idea of adrenal fatigue is that when we're under chronic stress, the adrenals kind of poop out and they get exhausted or fatigued. And then you're chronically tired because your adrenals are fatigued and not producing sufficient hormones, not to the degree of true pathologic adrenal insufficiency, but they're just not producing enough hormones to keep you energized. But really, what actually happens? What's real physiology of the adrenal glands?
Sure. So there's actually a cascade that begins in our brains. So our brainstem, specifically the hypothalamus, makes a hormone called corticotropin releasing hormone. And then this stimulates the pituitary gland, which is also in our brain, to make adrenocorticotropic hormone. And that is what will stimulate the adrenal glands to make cortisol. And this is very tightly regulated, and it can vary during times of stress. And if there is stress, whether it's acute stress due to like an infection or like a car crash, if somebody's in a car crash, then there is reduced feedback to the hypothalamus or the brainstem. And then this can momentarily increase cortisol levels. And then when people are under chronic stress, there also is a negative feedback. And then this can cause an increase in cortisol levels. But with chronic stress, there actually can be some growth of the adrenal gland. And then when there is elevated levels of cortisol from that can lead to metabolic syndrome, obesity, and these things that we deal with every day. Now, this idea of that the adrenal gland can get tired out and later have some kind of reduced amount of steroid production, that doesn't happen. There's no like overuse of the adrenal glands from like a daily functional type of stress. So what people are saying happens really doesn't truly happen. So they're calling this adrenal fatigue, and the way that they're testing it is really invalidated. Now, there is a real disease called adrenal insufficiency, and that's when the adrenal glands are not making cortisol or enough cortisol, but there are real reasons for that. Either there's been some damage up north, like in the brainstem, either the hypothalamus or the pituitary, or there's been damage to the adrenal gland itself. And there are clear ways where we can diagnose low cortisol in those very real medical conditions. But this idea of adrenal fatigue or this kind of like mild deficiency of cortisol due to overuse of the adrenal glands does not exist.
And so I think, adrenal insufficiency we've all seen it in the hospital, right? We've seen patients in adrenal crisis. We've seen patients as an outpatient who we've seen for a long time. Patients will die without physiologic supplementation of their steroid hormones in this dose. This is not like a vague condition that could be something but isn't something else. Like this, it could be an autoimmune disease. It could be there for several different reasons, but we have very strategic testing to identify adrenal insufficiency, and these patients are very, very sick. And if they don't get treated, they will die. And so that is something very different than this concept of adrenal fatigue. And I'd like to just point out, I think Dr. O'Leary did a great job of explaining the adrenal physiology, but I want you guys to note that she said over time, due to excessive stress, and what we're talking about there is emotional stress, yes, the adrenals might secrete more adrenal hormone called cortisol, more, not less.
Mhm.
And the adrenals don't, from chronic stress, they're secreting more, but they don't just poop out. So, and yes, that can lead to like blood sugar issues or overweight, obesity, blood pressure issues. And chronic stress can lead to that in multiple different ways, not just through the adrenals, but it's not the opposite. They don't get fatigued and poop out and stop producing adrenal hormones. And if that were the case, then we'd be dealing with something much more severe. And I think also when Dr. Alluri was talking about the HPA axis and the complexities of adrenal hormone secretion, that tells us why people are kind of getting carried away with this, because it's complex. It's not easy to break down. It's just not simple. And medicine is very much nuanced. Real medicine is very nuanced. However, the like influencer wellness grifter methodology is to oversimplify complex topics, and they use terms that we in medicine were taught not to use, like always and never. They're basically oversimplifying things by creating all or nothing terms or answers around them. And that's just not how the human body works. So if you're following an influencer who is using all or nothing terms, that's probably a red flag to maybe look for real medicine that is more nuanced. Because absolutely, if I could just give someone like a supplement to fix their fatigue and not give them any deleterious side effects or adverse effects, like we would be doing that too. But the truth is it's more complicated than that. So, Dr. Mehta, will you talk a little bit about the adrenal supplements, what they contain, and what those can do to the body?
Yes, absolutely. And y- adrenal supplements are sometimes, they have adrenal support, which means hormones from other sources like animal sources and bovine sources, and we know for a fact that any steroid that your body is exposed to can, in fact, suppress your natural ability to produce cortisol, and that can be dangerous, and that could, in the long run, lead to adrenal insufficiency because when you come off this supplement which you didn't even know had this steroid in it to begin with, it can your body will need some time. Your adrenal glands will need some time to wake up and produce their own steroid, and that can be dangerous and harmful. They also sometimes contain thyroid support, all of these things, which thyroid hormone. Oftentimes, it's more of T3, which is a short-acting, more bioactive hormone, and you can feel good in the short term, but in the long run, it can certainly be deleterious, and you're not even aware of it. And we run into this because a lot of the supplements aren't studied for safety or efficacy, and they don't have that rigorous process that a lot of prescription meds go through, and which is why we try to avoid them, and when we worry about the safety of taking these medications due to the things that are added in it that we're not even aware of or haven't been studied thoroughly.
Yeah. So most adrenal supplements are like bovine or cow adrenals, like dried and pulverized and put into a pill. And I personally think that's gross. But the bigger picture is that means you're getting adrenal hormones from an animal that are in some ways similar to humans, in some way not, in questionable doses that are inconsistent. And what the human body does when it gets a pill in many hormones, not all hormones, but many hormones, especially those that operate on the HPA axis, including cortisol, when they get it for free from somewhere else, like in the form of a pill or a supplement, they will stop making their own. They're like, I'm getting it for free. I don't need to work so hard to make it anymore. And so when you take these bovine adrenal gland supplements that contain cortisol, your body says, okay, I don't need to make it anymore, and it stops. And then you've actually created the disorder that is actually the dangerous version of this questionable or not even questionable, this non-diagnosis of adrenal fatigue, right? You've actually created adrenal insufficiency because the body is no longer making cortisol. And we call that iatrogenic adrenal insufficiency. That means it's the adrenal insufficiency that the doctor or prescriber gave you with their treatment. And that is a dangerous, life-threatening condition. Everybody feels good on steroids. Like, I've taken steroids. I had like a really heinous ear infection once, and I had to take high-dose steroids for it. And Vidya will tell you, she probably remembers, I thought I was Superwoman. I was literally running like 12 miles an hour on the treadmill, and I don't run that fast, you guys. So it was crazy. Of course, people feel great on steroids, but then after after a few weeks or months on them, your muscles start to break down. You can develop diabetes, high blood pressure. Over time, you can develop cataracts, osteoporosis, like all kinds of real bad things. So these aren't just like benign natural supplements. People think because they might be naturally cow in this instance, but because they are the word natural, they might be safer, but natural does not mean safe. They're still bioactive compounds. And what Dr. Mehta said about T3 is absolutely correct. When the Mayo Clinic studied several of these adrenal supplement compounds, the majority of them contain T3 in the compounds when they looked at them under, I can't remember if they looked at them under mass spec or liquid chromatography, but they looked at them in the lab and they did not say that they contain T3 on the label, but they did when they tested for the compounds. And T3, we like T3. We use T3 when indicated, but it's certainly not something you want to be taking without knowing it because it can cause hyperthyroidism, which can cause atrial fibrillation, strokes, osteoporosis, all kinds of bad stuff that needs to be, one, you need to know that you're taking T3, and two, you need to be monitored for if you're taking T3. So supplements, yes, they can be useful in certain situations, but they're not just this natural substance that has no potential side effect or adverse effect. It's simply like a pharmaceutical that has never been tested for safety or that it works for what it says it works. And the ingredients don't necessarily have to be accurate on the label. Okay, so tell me, what does an accurate workup look like for disorders of cortisol? And what are the names of those disorders, and what does an accurate workup look like? And what are we seeing online that people are selling that isn't consistent with that accurate workup? And how do we kind of know?
Yeah, so I can take that. So as endocrinologists, when we think about evaluating cortisol production in someone, we're trying to see if they're making the right amount of cortisol, but also if they're making not enough or if they're making too much. So adrenal insufficiency is the disease process where someone is not making enough cortisol. In order to test that, we check 8 a.m. cortisol levels to see if they're appropriate. The reason we check at 8 a.m. is that is when we have the highest level of cortisol in our body. So we know that's the right time to check and to see if it's low. And then there's even further testing if we do find that that level is low. We do stimulation studies using something called cosentropin, which is similar to the hormone that our pituitary makes to stimulate the adrenal glands. And then we try to see if the adrenal glands can be stimulated to make sufficient cortisol levels. Now, these tests have been validated and they've made it into our endocrinology guidelines in order to diagnose adrenal insufficiency. Now, the other type of process that we sometimes look for is too much cortisol. This is called Cushing syndrome or Cushing's disease, when someone can either make too much cortisol from their adrenal glands, or perhaps they are taking too much cortisol from, an exogenous source. So in order to do this, there's other testing that we do. We can measure urine cortisol, and we look at a 24-hour collection of urine to see how much cortisol somebody is making. We can also do something called a dexamethasone suppression test. In this test, our patient actually takes a steroid hormone, and that should suppress the body's ability to make cortisol. So we'll do that type of test. And then we can also test salivary cortisols at midnight to see if those levels are elevated, because it should be low in the middle of the night. So these are the validated tests that we do for kind of our initial screenings. What we've seen is there's a whole lot of non-validated tests out there that we notice our patients are getting. They're getting salivary cortisols throughout the day, and then they're getting graphed, and then they're being told they have adrenal fatigue. And really, none of those studies are validated. I think it might be easier to get those testing done, and that's why they do them. But they're getting these tests that are not validated, and they're not standard diagnostic tools. And then they're getting inappropriately interpreted, and patients are being labeled with these not real diagnoses and then being given treatment that could be harmful.
Yeah, and I think Dr. Alluri talked about what we call dynamic testing. And so that's like a test that you have to do stuff for. You kind of have to be actively engaged. So, it's easy to get a blood test. We would love to just get a blood or urine sample that we send you to the lab once to get that test. It's easy, quick, whatever. But with excess cortisol and adrenal insufficiency, the testing is dynamic, so it's more complex. And what I mean by dynamic is, for example, the ACTH stimulation test for adrenal insufficiency requires you to be in an office with a nurse who's putting an IV in you to give you the concentropin and timing the draws of the cortisol. The 24-hour urine collection requires you to take a urine collection bottle home and pee in it every time you pee for a whole day. Midnight salivary cortisol requires you to stay up until midnight and put your saliva in these little tubes, basically, that you bring into the lab. Overnight dexamethasone suppression test requires patients to take a dexamethasone pill at 11 o'clock at night and then check their cortisol, go to the lab and get their cortisol drawn in the morning before 8 a.m. to get an accurate result. So these are complicated tests that we don't love putting patients through, but these are the ones that have been validated to give us the closest to real answer on a diagnosis. And that's why we do them, because there's so much potential for misdiagnosis, false positive, false negatives that we don't want to occur in these settings. Now, there's dried urine tests. There's people who are just checking a spot cortisol throughout the day. There are people who are checking, like Dr. Alluri said, salivary cortisol throughout the day in unvalidated ways. And so that means it hasn't been looked at and compared to other studies and things like that. So, when the data is inaccurate or potentially inaccurate, you can't really act on that data safely. And I have seen patients told they have adrenal problems when they've had this salivary cortisol that's tracked hour by hour throughout the day, showing a perfect circadian curve of cortisol. Cortisol is secreted max in the morning. It's kind of the wake-up hormone. It raises your blood sugar, raises your blood pressure, helps you wake up, and then it troughs off during the day and even more so during the night. That's why we have to check things at certain times of the day, like Dr. Alluri alluded to. But patients maybe don't know that. And so when they see their cortisol dropping off in the afternoon and they think it's supposed to be stable throughout the day, and you're telling them that it's low in the afternoon or evening, and they have a problem called adrenal fatigue, and selling them a supplement for it, it makes sense. They're looking for an answer and you're giving them an answer, but your physiology is wrong, and your treatment is wrong, and your data is wrong, and your data interpretation is wrong. Therefore, your diagnosis was wrong. So it is a complicated system. It's nuanced, and sometimes we have to do multiple confirmatory tests. Like when we're screening for Cushing's, we do all 3 of those tests. And then sometimes we have to do even further testing to see where it's coming from. Is it the brain? Is it the adrenals? Which adrenal is it? Do we need to do surgery? So it is complicated testing. And I feel like wellness grifters have kind of hopped on that complicated nature of this and tried to oversimplify to sell to patients, which isn't okay. But let's talk about the patients. Okay, so the patients are actually coming in feeling wired or anxious or tired or exhausted, and they think that they might have a problem with cortisol. What should we actually be talking with these patients about?
I think it's important to first hear them out and listen to all their symptoms and what are the most pressing symptoms. And then I think taking a good history is so important, putting it in context with their family history, their social history, their lifestyle, their sleep, where they are in life in terms of, a lot of our patients are women, and if they're what their menstrual cycles are like. Are they heavy? Uh, are they premenopausal or perimenopausal or postmenopausal? All of these things are so important. Sleep. So, getting a good history and understanding what symptoms they're experiencing, and then y- the you want to approach it and do it in a thorough manner so that you don't miss something. You don't just simplify and put it all into this bucket of, oh, it must be your adrenal glands because you're tired and you can't sleep and you have a lot of stress that you feel like your body can't respond to. You can miss important things, and you can find you can miss sleep apnea, you can miss iron deficiency anemia, or it could be something related to their hormones or a thyroid. So, having someone who will look at everything and test for everything, and then give you a very accurate diagnosis, find some treatment options, and if they don't work, we go back to the drawing board and figure out how can we help you. So, just looking at the patient and getting a good history, doing a physical exam, all of those things will really help understand what's the cause of these symptoms.
Yeah, and I think that concept of anchoring on a diagnosis can be really, really dangerous. And when patients are coming in with symptoms like fatigue or weight gain or hair skin changes, irritability, they can be multifactorial. It may not just be one thing that's going on. They might not be getting enough sleep. They might be going through perimenopause. They might have hyperthyroidism or hypothyroidism. Like many things can be going on in one person. So we need to evaluate for everything and have an open mind. But I do understand, in our practice, we're a direct care practice. We spend a lot more time with our patients and really diving into these histories, and our patients and we have the luxury of doing that. But it's not possible in a lot of rushed primary care settings or even rushed endocrinology settings. And a lot of people can't get into endocrinology because of the long wait list to get in. So if you are struggling with this and you're not able to find a doctor, I really recommend considering maybe direct care. It's may not be as costly as you think it might be, even if you just go for one consultation to get things kind of straightened out. And if you go to a provider that you think will be helpful and their treatment plan for you is mostly a bunch of supplements that they sell in their clinic, you know, that should be a red flag. There's a reason that we have like laws, the Sunshine Act, like the laws that doctors can't get paid to sell pharmaceuticals. It's illegal because we don't want to be pushing things onto our patients because we financially gain from it. But that regulation is not there in the supplement industry, and so you can actually look up how much Dr. Mehta, Dr. Alluri, and I have gotten paid by pharmaceutical companies. It's publicly available on the internet, whereas that information for supplements is not publicly available. So really just I think part of this, the purpose of this podcast is to teach our audience discernment. Like, you really need to discern for yourself in this healthcare environment who is trying to make a buck off of you or who is really caring about your health. And it's hard to know, but someone who sends you home with like a box full of supplements might set off my spidey sense. So, Dr. Lurie, if a listener has already spent money on these tests and supplements, still feels terrible, feels confused, what would you tell them? And what's kind of a path forward that doesn't dismiss the patient or their symptoms, but really redirects them towards real care?
Yeah. I mean, we actually do end up seeing a lot of folks that have been treated with various supplements being kind of given these obscure endocrine diagnoses in our clinic. And I'm so happy that they end up with us, because I think if you have been given a questionable diagnosis that is related to your hormones, like whether it's, adrenal fatigue or cortisol excess or some kind of cortisol, issue, or even a thyroid issue where the treatment plan has included like buying supplements or paying for additional tests, my recommendation would be to see a board certified endocrinologist that can really help you sort through what is going on and what supplements you were given and whether or not they can help you or be harmful. And it is something that we do in our clinic all the time. Unfortunately, I always hope that patients find us first, but if they have seen one of these providers that start some of these supplements, it almost is going back to what the original symptoms are, like what testing can be done. But oftentimes we do go through each supplement in detail, look at what the ingredients are, explain what each one does. And it's kind of a process of stopping each supplement and then retesting with validated tests, the thyroid and, the adrenal axis, and seeing what we can find, as well as like an actual thorough history and physical. But that's what I'd recommend is, if somebody's told you, or someone that you paid for, some provider said that you have a hormone disease or a hormone issue, it's best to see an actual board certified endocrinologist to evaluate you.
Yeah, and I think easier said than done, right? Like finding an
Mhm.
endocrinologist and finding someone who actually can walk through all of this, your history and your supplements, and do all of those things. Like, I think Vidya and I both had patients yesterday that I spent 45 minutes talking
Mm.
about supplements to a patient. I loved it, and I was happy to. And Vidya did the same, because we believe it's important. And some of the supplements could actually have been helpful to the patient, and some wouldn't. And I was able to like tell her what they were, what they do, why they might be helpful, why they might not be. But I think, when you are looking for a doctor, I think there's a couple of steps to take. One, look up their credentials, right? Like, there's boardcertification.org. Check if they're board certified in the field that they are trying to treat you for. So if it's for hormones, for example, make sure you're looking for a board certified endocrinologist or someone who at least has been board certified in the past. Some people do let their board certifications lapse, you know, 10 years into practice or 20 years into practice because they don't want to go through the hassle of recertifying. And on there you can find, if they're board eligible, if they're board certified, that means they completed their fellowship in endocrinology. And then go to your medical board, your state medical board website. There is publicly available information on every doctor on whether they've had any disciplinary actions from the board. Sometimes I look up these practitioners who are selling a bunch of like hormonal supplements and stuff, and they're not licensed. They're not board certified. They have lost their license for a reason that you can read the whole, like, sometimes if you really want to go down a rabbit hole, you can read the whole lawsuit. You can read a lot of information that can tell you about a practitioner. And then after you've done that background check, if you will, on your doctor to ensure they are in fact a doctor. They actually went to medical school, residency, fellowship. They're board certified. They have good status with their state medical board. Then go to Google. Okay. Then go look at your Google reviews. And if it seems like they're a good fit, they have good reviews, other people like them. That tells you a lot about bedside manner, how their clinic operates, that type of stuff. I think that's probably a much better way to go about it than the opposite, which is what most people do. Like most people go to Google first, and some of the people with the best bedside manner are not credible sources of information, unfortunately. Some of the best marketers are not the ones who have actually had any training or experience. And I actually, by this time, you guys probably know me. I'm a little extra, but I've asked these people, why are you making recommendations that are so contrary to evidence? And they'll say, well, I'm not a real doctor, so they should be talking to their doctor first. And it's like, okay, well, you have 1 million followers on Instagram. So they're not talking to their doctor first, and you know it. Oh, my recommendations are based on my own personal experience. Okay, your personal experience, that's not the same as someone else's personal experience. It's not good enough. It's not safe enough for our patients. My patients aren't actually sick. You see patients who are actually sick. Okay, so why are you telling them they're sick and giving them supplements? So there are all these really, really, in my opinion, weak answers to selling misinformation, right? So, and I just did this last week. If you were watching my Instagram stories, you guys heard about it. So I think just use this podcast to help you use your own discernment to find safe, credible practitioners. And you may not find the right one the first time. It's okay to keep looking and ask us, reach out to us, even if you're not in Texas, Oklahoma, Kansas, or Wisconsin. Those are the states we serve. If we know someone, we will help you get to the right person. So that was cortisol, adrenals, adrenal fatigue, and what it is not, mostly in a nutshell. We hope you guys enjoyed this episode. If you did, please share, comment, share with someone who this might help, and follow along on our journey. And let us know if you have any episode requests or topics you want us to talk about. We're here for you guys.